Hi, this is Dr. Shanna Garza. I'm an adolescent medicine physician in McKinney in a practice called Girls to Women Young Men's Health and Wellness. I'm the clinic director there, and our office is part of a larger group of three locations, one in McKinney, one in Dallas, and one in Fort Worth. We work to offer comprehensive medical and mental health care to patients aged 10 through 25. And part of the work we do is caring for patients with eating disorders. In my work in adolescent medicine, I try to take care of the whole person, and that involves doing a medical assessment as well as mental health assessment. In eating disorders, this is really important. Today, I'm going to talk about the general assessment we do for the medical stability of eating disorders. First, it's very important to check a patient's weight. With that, we are looking at their actual BMI, which is their body mass index. We also will calculate the percent of their weight that is percent of their ideal body weight. And in pediatrics, we will look at the BMI percentile, meaning how they compare to other children and teens their age and same height. We also do vital signs, of course, like you see when you go to any doctor. But the things we're looking for when we're looking at the medical complications related to eating disorders relates to heart rate and blood pressure. Heart rate may be too low and blood pressure may be too low, and that can be a sign of medical instability. Also, if heart rate and blood pressure are too high, that can be an issue. We check patients' heart rate and blood pressure in different positions, and that's called orthostatic checks because we're looking to see how much heart rate and blood pressure vary in different positions, specifically lying, sitting, and standing. We also order lab work as part of our evaluation of patients with eating disorders, and it's very extensive labs. We're looking at blood counts to see if there's any suppression of bone marrow that can be due to malnutrition. We check electrolytes, kidney function. Electrolytes can vary, especially in patients that are purging. We check thyroid function. Thyroid function can be suppressed and low in patients with restriction. We check prealbumin, which is a lab that really assesses a patient's nutritional status. There are some additional labs we look at in patients that have history of purging. And finally, there are labs that we look at in patients that report irregular periods or periods that have stopped. We're looking at estrogen levels and other female hormone levels. So this is a way that we get more information about how the eating disorder has affected our patients and really making sure that patients are stable and safe to continue being cared for in an outpatient setting.